The rotator cuff is a group of 4 muscles located deep in the shoulder that attach to the scapula and humerus. If you were to look under the skin and adipose tissue, you wouldn't be able to see all the muscles of the posterior rotator cuff. You'd only be able to see the infraspinatus, the teres minor, and a little bit of the teres major, which isn't a part of the rotator cuff. In order to get the best view of the posterior rotator cuff muscles, you need to remove the trapezius and remove the latissimus dorsi. These muscles attach to various spots on the scapula, but only 2 spots on the proximal humerus, the greater tubercle and the lesser tubercle. These muscles collectively work to stabilize the glenohumeral joint and individually work to abduct, internally rotate, and externally rotate the glenohumeral joint.
So the first muscle we're going to talk about is the supraspinatus. The supraspinatus is located on the posterior superior side of the scapula. It originates in the supraspinous fossa and travels laterally inferior to the acromion process and acromial end of the clavicle. It then goes to insert on the greater tubercle of the humerus. This muscle is innervated by the suprascapular nerve. So the second muscle we're going to talk about is the infraspinatus. The infraspinatus is also located on the posterior aspect of the scapula, but now it's inferior to the supraspinatus and the spine of the scapula. So the infraspinatus originates on the infraspinous fossa, and it travels laterally and inferior to the acromion process, and it also attaches on the greater tubercle. This muscle is also innervated by the suprascapular nerve.
The teres minor is located on the lateral portion of the scapula. It's located superiorly to the teres major, which is a larger muscle but is not a part of the rotator cuff. It originates on the lateral spine of the scapula and travels laterally and superiorly to insert on the greater tubercle of the humerus. It's innervated by the axillary nerve. The subscapularis is the only muscle of the rotator cuff that originates on the anterior side of the scapula. So if you were to take the scapula and remove it from the skeleton, it would be located on the subscapular fossa here, and it inserts on the lesser tubercle of the humerus. It's innervated by the subscapular nerve.
So the action of the supraspinatus is abduction. We know this because the action is done in the frontal plane, which cuts the body into the anterior and posterior portion. We also know that the action is done along the AP axis, which runs anterior to posterior as well. So this axis goes through the convex part of the convex concave joint, in this case the glenohumeral joint, and the muscle fibers run superior to this axis, so they pull up and cause the motion of abduction.
The infraspinatus and the teres minor assist with the action of external rotation. This takes place in the transverse plane, which divides the body into superior and inferior portions. The action takes place along the vertical axis. We know that it assists with external rotation because the muscle fibers run posterior to the vertical axis. So the subscapularis muscle is a little bit more difficult to visualize since it's located on the anterior surface of the scapula. But imagine if you could see through Gabe's chest. This muscle assists with internal rotation, which also takes place along the transverse plane and the vertical axis for the same reasons. This muscle assists with internal rotation rather than external rotation, because in this case, the muscle fibers are located anteriorly to the vertical axis.
To summarize, the 4 rotator cuff muscles can be made into an acronym, SITS, S-I-T-S. That stands for supraspinatus, infraspinatus, teres minor, and subscapularis. There are a few aspects that these muscles have in common that may help with your memorization. 1. The supraspinatus and infraspinatus are innervated both by the same nerve, the suprascapular nerve. 2. The infraspinatus and teres minor's action is both external rotation. 3. The subscapularis is the only anterior muscle of the rotator cuff muscles. And finally, all posterior muscles, the supraspinatus, infraspinatus, and teres minor, insert on the greater tubercle of the proximal humerus. That concludes our presentation. Thanks for watching.